Hello to everyone. I would like to introduce myself first. I'm working in the Istanbul University, Istanbul Faculty of Medicine, Department of Physical Medicine and Rehabilitation. Today, I would like to talk about the hip joint injections under ultrasound guidance. And as you know very well, the hip joint is the largest joint of our body, and it has very important functions such as walking, climbing, or lying, or sitting, or standing. And in the elderly population, we have important problems of hip joint, such as osteoarthritis. And we have a lot of different kind of options for the treatments. For osteoarthritis, first of all, we are giving some advice for patients in the daily living activities. And if the patients have some overweight, we can give some advice for the losing his or her weight, or some exercise, also very important. We are giving some exercise for this kind of patients, for instance, strengthening exercise, range of motion exercise, and sometimes we are giving some special exercise according to patient status. And we are using physical medicine and rehabilitation modalities such as transcutaneous nerve stimulation, or hot pack, or therapeutic ultrasound. And we are using some medications also for this kind of patients, some local non-steroid anti-inflammatory drugs, or some oral painkillers. Sometimes we are using supplements for this purpose, and we are using some glycosamine sulfate, or chondroitin, or curcumin for this purpose. And the injections also so important, and the final treatment of hip osteoarthritis is total hip replacement. In terms of the success of the HA, we should consider three main domains. One of them is the right product. The other one is the right patient to make an injection, and you have to need some right skills to make a right injection. Then today I would like to make injection of Alsasyn. Alsasyn has 88 milligram HA and 4 ml. It has some lightly cross-link and linear HA, and it is very important product that we are using for HA injection inside of the hip joint. Alsasyn has a bacterial fermentation product that's very important in terms of low allergic reactions for the patients. We are using full sterile condition for the hip joint injections. We are using a green cover and some sterile pads, and this one is spinal needle, 9 centimeters, 20 gauge, and we are using 5 ml standard shrinks for local anesthesia before the injection. Now I'm opening the Alsasyn like that, and I will throw out it to here. I'm cleaning the injection area with the iodic solution. Yes, and I'm cleaning the also probe with the iodic solution. And I'm using sterile gel. Okay. I put my probe longitudinally, and you can see on the screen now the acetabulum on the left side and the acetabular labrum and the femoral head and the femoral neck. Our target point to entrance to the joint is the junction of the femoral head and the femoral neck. I'm not targeting the real joint, but I'm trying to be inside of the capsule. And if I go a little bit medially, you can easily see the femoral artery. If I put the Doppler image, you can see now the femoral artery, and I'm putting out, and I'm using the, as you see here, I'm using the convex probe with low frequency to get a better image in the deeper side of the hip joint. Then I'm replacing my probe again to the right place. Then I'm starting to make injection. First entrance. Oh. If your patients have some pain, you can easily use a little bit local anesthetic solution. Now I have a 1% lidocaine in the inside of the shrink. Now I'm enhancing. And I'm trying to touch the bone. Now I'm trying to catch the bone. And once you see my needle tip on the ultrasound, and now I'm trying to make a little bit local anesthesia. You see the enhancing of the capsule. Now I'm the inside of the joint. I confirmed with the local anesthesia. Then I can make my injection to the inside of the joint. If you have some resistance, you can check once again. Do you have pain? The patient has no pain at all now. And I'm making my injection accordingly. You need, and if you have some resistance, you can stop, but now it's looking well. Then I will throw up my needle. Thank you.